names are Pharmacist Abdullahi Rabiu Abubakar, University Sultan Zainul Abidin, Terengganu, Malaysia. The study I'm about to describe is titled Comparative Study on Drug Safety Surveillance between Medical Students of Malaysia and Nigeria. Globally, there is an advancement in the field of drug discovery, drug development, and clinical trials. Also, new and more efficient drug formulation techniques are evolving. However, despite these achievements, a lot of adverse drug reactions are happening which are yet to be on records. And these adverse drug reactions are found to be the first leading cause of death in an advanced country like United States of America. The purpose of this study is to compare knowledge, attitude, and practice between medical students of Malaysia and Nigeria in terms of adverse drug reaction and pharmacovigilance. The method we employed in this study involved a questionnaire-based study, and the study population involved Year 4 and Year 5 medical students of UNISA in Malaysia and Bayero University, Kano, Nigeria. Before we begin this study, we obtained ethical clearance from both UNISA in Malaysia and Bayero University, UK in Nigeria, and the students were given consent form and information sheet for their consent to participate in this study. Also, we used 20 medical students that were not part of the main study, give them questionnaire. Their response was evaluated for reliability and validity, and the Cronbach alpha was determined to be 0.69. The questionnaire comprised of 7 demographic informations, 10 knowledge questions with yes or no options, 7 attitude questions with strongly agree, neutral, and strongly disagree options. Finally, 8 practice questions with yes or no options. In Malaysia, the data was collected by self-administering the questionnaire, while in Nigeria, the questionnaire was given to the medical student by their lecturers. The result analysis, first of all, descriptive statistic was carried out on demographic informations and other variables. Then we carried out independent t-tests to determine if there is statistically significant difference in terms of knowledge, attitude, and practice with regard to adverse drug reaction between Year 4 and Year 5 medical students and between genders. Also, independent t-test was carried out to determine if there is statistically significant difference in terms of knowledge, attitude, and practice score between medical students of Malaysia and Nigeria. Then finally, we employed correlation analysis to determine if there is a relationship between their knowledge and practice. So from this study, we established that there was no statistically significant difference in terms of mean knowledge, attitude, and practice score between Year 4 and Year 5 medical students and between genders as well. Also, we established there was a statistically significant difference between medical students of Malaysia and Nigeria in terms of practice and knowledge. Finally, we established weak relationship exists between knowledge and practice. So from this result, we can conclude that Medical students of Nigeria have more knowledge and practice with regard to adverse drug reaction and pharmacovigilance, which can be attributed to the fact that BUK in Nigeria have been graduating their students for more than 15 years compared to UNISA in Malaysia. We can suggest that knowledge of adverse drug reaction can be improved by upgrading and improving medical student curriculum from grassroots. Thank you very much.